Well, good afternoon. Today is an exciting day for Ontario. Our public health trends are improving. For the first time in months, we're under 200 new cases today. We've hit a new record for testing this week, over 28,000 tests in a day, and still an overwhelming majority of these tests, about 98% to date, have come back negative. The number of long-term care homes in outbreak continues to drop, and their status across the broad is improving. And today, we are moving forward with stage 2 of our plan for reopening. It's all thanks to our heroic frontline healthcare workers, the collective efforts of every Ontarian, and our brave men and women from the Canadian Armed Forces who are extending their mission until June the 26th, and I thank you. Because of that commitment, dedication, and steady progress, our most vulnerable are safer and more people are headed back to work today in many corners of our province. In 24 regions across Ontario, from Chatham to Kingston, to Thunder Bay, to Guelph, barbershops, hair salons, and shopping malls are reopening as part of stage 2. Restaurants and bars in those regions are opening up their patios with strict public health measures in place. Whether it's the mom and pop shops or Main Street mall business owners, I encourage everyone in these communities to show their support this weekend and shop local. As promised, we'll have another update on Monday. And we know more regions of Ontario will join them very, very soon, especially if we continue to see these downward trends across the province. We want to get people back to work as quickly and as safely as possible and get our economy roaring once again. But we also know it's about taking steps to help people's lives get back to normal. Today, the limit on social gatherings will increase from 5 to 10 people. As of today, our places of worship will be able to reopen. And beginning next Thursday, our long-term care, retirement homes, and other congregate living settings will be able to start accepting visitors. We're finding ways to bring families and friends together again safely after being apart for so long. And today, we have more good news to share with the people of Ontario. We know there are friends, families, and loved ones who you haven't been able to hug or come in close contact with in months. And today, the public health guidelines will be changing to introduce social circles. Minister Elliott will provide more details in a moment, but this is a very, very important step forward. This change will expand the number of people who we can come in close contact with who live outside our homes. Social circles will allow family and friends to reunite safely while reducing the risk of exposure and spread. This means finally hugging a grandparent or sharing a meal with your parents or closest friends. But as we reopen and as we reunite, we must continue to remain on guard. And while we know some of the toughest challenges may lay ahead, I know we'll get through this together and come back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. On a day when most of Ontario is proceeding to stage 2, we reached an important milestone. The province saw the lowest day-over-day increase in new cases since March 28th. In fact, 28 of Ontario's 34 public health units added 5 or fewer cases, with 17 of them seeing no new cases at all. This is a remarkable accomplishment, and one that is only possible because of the collective efforts of every Ontarian to stop the spread of COVID-19. And it has not been possible without sacrifice, including and especially precious time apart from friends, family, and loved ones. With so much progress having been made, Dr. Williams, our Chief Medical Officer of Health, has updated public health guidelines, effective immediately province-wide, to allow for social circles of up to 10 members. Think of your social circle as the people you can touch, hug, and come into close contact with as we continue our shared fight against COVID-19. A social circle is made up of families and friends that you can interact with without the need for physical distancing. There are 5 simple steps to building a safe social circle. First, start with your current circle, the people you live with or who regularly come into your household. Second, if your current circle is under 10 people, you can add members. This could include family members you want to spend more time with, perhaps grandparents, or another household with similarly aged children. Third, get agreement from everyone that they will join the circle. Fourth, keep your social circle safe. Maintain physical distancing with anyone outside of it. And fifth, be true to your circle. No one should be part of more than one circle. After months of battling COVID-19, social circles will help people struggling with isolation. They will also help provide more support for the people who need it, including more childcare options. Social circles will also enable Ontarians to enjoy close contact by dining together at home, outside, or on restaurant patios with other members of their circle. But I do want to be clear, the rules for social circles are different from the recent expansion of social gatherings from 5 to 10 people. Social gatherings can be any 10 people from outside your household or circle, but where physical distancing of at least 2 meters must be maintained. For example, the expansion of social gatherings will allow individuals and families to enjoy the company of others at backyard barbecues and picnics in neighborhood parks while respecting physical distancing guidelines. Combined, and as we enter the summer months, there are now more opportunities for Ontarians to enjoy the company of others. I know many people are eager to reconnect with their family and friends, and we are just as excited to share this next step with you starting today. Thank you.
Okay, we'll go to the phone line for questions. Just a reminder that it's 1 question and 1 follow-up.
And your first question will be from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. How are you today?
I'm doing really well. You know, I'm feeling good. We had 28,000 tests, and things are coming together. But I want to thank Dr. Williams and all the chief medical officers of health for the great work they're doing. I want to give another shout out to Matt Anderson. He's instrumental in getting these numbers up. So, but as I always mention to everyone, don't take your foot off the pedal. Keep going. You know, and they're going to keep going. But looking forward to the weekend.
I think we all are. And geez, I hope that doesn't count as my first question, Premier.
No, you always get.
Okay. So my question to you is, in the past 5 days, the COVID positive numbers have gone down 44% than the previous 7 days. And I'm wondering if now that you see these numbers and this real low that we hit today, the first since March, do you think it was actually necessary to hold off on the rest of the GTA opening up today as well, along with the rest of the province? And do you foresee it opening up, you know, on Monday? You say you'll be reassessing.
Well, based on the numbers in certain regions, we saw certain spikes in those 10 regions, and I just asked people in those regions, please be patient, and over the next very short while, we'll be able to open the 10 areas up very shortly, based on the numbers, in case there's a spike, because we have seen numbers go down and then spike up, but this is pretty low, I have to admit. These are really positive numbers, but we can't let our guard down for a second. But just those folks, please be patient, and I know we'll have some good news very shortly for you.
Follow-up?
Okay, and these previously known as family bubbles, now known as circles, yeah. There has been so much confusion over them, and I think it causes frustration amongst people because they want to follow the rules, but they don't really know what they are. So what is the best way to explain it? Is it you can hug and kiss people in your social circle, but not in a public gathering? And can you give me an example of what you can do? Like, can I go to a friend's barbecue and sit outside with 10 people tomorrow, 6 feet apart?
I'll pass it over to Minister of Health.
So the answer to your question is yes. We're talking about two different groups. We're talking about the social circles of 10 people and then social gatherings. Social gatherings are friends, family. They don't necessarily need to be part of your social circle, but you do need to continue to maintain physical distancing. So you can see them, you just have to be spaced 2 meters apart and observe all of the other public health guidelines that we've talked about many times. With your social circle, that can be 10 people that you want to not have physical distancing with, that you can hug, that you can be in closer contact with. And most people just start with whoever they live with, their family, roommates, whatever, that they would be the natural start, and then you can build from there. So it's really just common sense for most people. It would be perhaps grandparents that they'd like to bring into their social circle. In other cases, it may be a situation where two families might get together where there are children of the same age and they want to be in the same social circle as well for the benefit of their children, so that their children can see each other, and that the parents in some cases can also share some of the other duties, perhaps taking care of the other people's children so that they can go to work. So it's definitely different for every person because everyone has different social contacts, but it really is, if you just start with your own personal situation and then build it from there, it really isn't difficult. It's mostly common sense when you finally take a look at it.
Next question
is from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Hi, Premier. Are there any concerns about today's announcement that people will just hear they are now allowed to come in close contact with their loved ones, they are allowed to be physically close, and really not adhere to this agreement of staying in a circle of just 10 people? And how are people supposed to trust each other that they will stick to that?
Well, they've been doing a pretty good job so far in following the protocol, but if you don't mind, I'll pass this to Dr. Williams. Thank you.
Yes, thank you, Haley. And as the Premier said, up to now, our Ontarians have done a great job of staying at home. They've honored those requirements. They have kept the distancing. They have now started wearing facial coverings in public settings. So Ontarians in general are concerned. At the same time, they're pleased to have the opening up of the province. They understand that their family, individuals, or say a couple, they have maintained that and they respect each other in that regard for the health of themselves and their children. So I think that to say we're going to honor that trust to go further, to say in the social circles concept, they have a need, and many say we would like to be able to have that type of thing we have with our own family and our household with some more added in that. You don't have to go to 10. You can add as many as you want. You can add them over time, so it isn't instantaneous. As the minister said, take some time, it's common sense, think about it, of how you'd like to do that. Because in that time, you want to trust the people in your group, and part of that is that if there were cases in the future, it helps us with case contact management. We only know if it's you and 9 other people, you know that if someone is there, it's the other 9 that we're concerned about. That's how you're vigilant and you keep up your trust in that way. So we're asking Ontarians, as the province opens up, be more concerned about your behavior out in the public with your distancing and with your masking. And if you're going to do a social circle, honor that with your friends and do it diligently and respect that, because this is a first step in a number we're planning in the future. So think about that for now. Let's do this social circle well, because people have said, we really feel desperate to get together. There's needs, there's people lonely, there's people that are hurting, and they want to have that family connection, and so, or friendship connection. So let's do it, and I'm sure that Ontarians will honor that and do their best at this.
follow-up?
Thank you. And my follow-up question, a lot of people, well, pretty much everyone, have been staying home for months. They've been doing some spring cleaning, and a lot of charities and shelters depend on donations. So, Premier, do we know when donations can start to be accepted again from people to shelters and these charities?
Sure. In what form? Just like.
Like books and clothing.
I better hand that over. I apologize, Haley. I've got to hand it over to the doc here. He's the expert.
It's a good question, and I think what I've been seeing is people's generosity, people concerned about those that are in need and wanting to help out in that way. I think if you're going to do that kind of aspect and donation, you have to talk to the organization and group that you're donating to. They have rules around what they're willing to accept, what is safe, and what they have to do as well as part of sanitation and not spreading infections. So talk to those organizations. They're eager to receive it, but you have to follow the stipulations and rules they have, because you don't only want to help someone, you don't want to hurt them with wrong material and that, and there are constraints and rules in regards to that those are experts at this have done for many years, and you need to listen to them and take their advice in this regard.
Follow-up?
Next question.
Hello? Oh, sorry. Next question.
Thank you. Next question will be from Randy Rath at CHCH TV.
Hi, Randy.
Hi, Premier. I'm just wondering, have we reached the point of COVID fatigue in this province? You know, we're talking about social circles, family bubbles, gatherings of 10. Are we at the point where people are just going to say, oh, well, you know, whatever, and just do as they please?
Hi, Randy. I hope not, because the reason we have the low numbers are because of the people of Ontario, really. And when we started to ramp up the testing, I guess we're all concerned. The more tests you're going to get, the higher numbers you're going to get. But look what's happening. The numbers are going down, and because of everyone listening to chief medical officers' protocols, that's the reason we're doing extremely well. I think I mentioned it before, Randy, but I saw a chart that compared us to a whole bunch of U.S. states, relatively the same size of ours. I guess the only other province would be Quebec. But we're leading North America per 100,000 cases. And again, it's not our government, it's the people. The people made it happen. So I'm so grateful, the frontline healthcare workers and all the emergency services, service workers and essential service workers. So they're the ones that get all the credit, not us. But they're doing a great job. But I hear you. I do. I hear you. But just everyone has to hang in there just a little bit longer, and we're making massive strides. We really are.
Follow up?
Okay, fair enough. Also, today, Prime Minister Trudeau announced that it would be mandatory for people to have their temperatures taken as they went onto an airplane. Is that something that would be useful with people getting onto GO trains in this province, particularly the longer runs on those trains?
I don't know if we can handle that mass volume all at once if we get back to normal. We're down on Metrolinx. We're down 90%. On the TTC, we're down 80%. And if we get back to normal, it's just packed. I don't know if that would be realistic, but I'd like the Minister of Health to comment and have her opinion on that.
Well, I think we're continuing to do as well as we can. We want to make sure that people are going to continue to be safe. With respect to temperature taking, that's one thing that you could do. I think Dr. Williams could have some suggestions on that as well. But I know that that's something that people are concerned about, that having had a discussion with several large employers this morning, one of the biggest issues of their employees is using transit, both GO trains and the subway buses and so on to come to work. But perhaps I'll ask Dr. Williams to express his view with respect to that.
Yes, well, at our federal, provincial, territorial committee meetings, we were discussing a lot of ideas and concepts around that. Temperature screen is one tool, as the minister said. It has its limitations, and you have to back it up with other ones, such as a history of contact, people being cautious, wearing facial covering, and of course, on those type of methods of transportation, what is the distance and spacing? And we're seeing already in our public transit here in the City of Toronto, they're already holding off certain seats and allowing people to distance. So these are key things in the ongoing. If a plane ride does not allow that, or it's closer and you're in a closed airspace at that time, I guess the Prime Minister wants to take all cautions as possible to rule in and rule out, but people still have to be vigilant, understand they're still wearing facial coverings while they're on the flight, and other aspects there. So it's another tool in the box, but it's not the only one you can rely on. You need, as the Minister said, other parts and aspects addressed to ensure you're ruling out any potential cases, even early asymptomatic cases or pre-symptomatic cases.
Next question.
Will be from Colin DeMello at CTV News. Please go ahead.
Hi, good afternoon, Premier and Minister and Dr. Williams. So Guelph Public Health is calling for mandatory masks at commercial settings. However, Waterloo Public Health says that's not a good directive in their opinion. The Region of Waterloo says they would prefer more clarity from the province so that residents and businesses aren't really confused by this patchwork of public health orders. So to you and Dr. Williams, should masks be mandatory in commercial settings as Guelph is calling out for?
Well, Colin, you know, I've always said I'm not the medical professional, and I apologize to keep passing the questions to folks, but these two folks are the professionals when it comes to health. So again, I'll pass it over to Dr. Williams.
So just so I'm clear, Colin, you said at commercial settings?
Yes, at commercial settings. That's what Guelph Public Health is calling for, mandatory masks at commercial settings.
Correct. And I think what we've had in place, that if you're going to a center where people are congregating in the public setting, there still is the 6-foot distancing and the use of facial covering if you are not able to maintain that. And some stores and facilities, knowing the layout of their buildings, have put that in place to have the distancing, allowing only so many people in the commercial setting, asking people to honor certain pathways and routes through the store because they want to do their best. They are trying to protect their workers. They have the plexiglass screens and all those things there. And that includes people wearing facial coverings. Some, as I think the medical officer of health in Wellington, Dufferin, Guelph, has found that there has been lack of adherence to that, and so she's asking that case that it be made mandatory. So that helps the store owner to say, in spite of some people saying, I'm not sure I see the need, they say, well, it's required, you need to do that. Because they want to maintain the safety of themselves, their patrons, and their staff, and they would like people to adhere to that and respect the retail center, and respect each other in that regard. So again, as we've been talking about, as the Premier talked about, we need Ontarians to keep doing their best. We've got to step forward. These are steps one at a time, and we're going to get there. We're making great progress, but all these are parts of doing the right thing in the right way at the right time.
Follow-up?
Perfect, thank you. My next question is to the Premier. Premier, when it comes to the social circles, why not do this by family instead of individual households? I mean, take yourself, for example. You have adult children who live in several households. Isn't this like Sophie's Choice? You got to pick which one is your favorite. Wouldn't it make more sense to say immediate members of one family can now merge, as opposed to saying your household can now merge with one other household?
Colin, I apologize, my friend. I got to pass it over to the Minister of Health. Thank you.
Well, in many cases, that would be what would happen, but in some cases, it's people may live far apart from their family members, and it may be more appropriate to associate with another family. For example, using the children's situation where two children are close friends than the parents and any other children they have in their families, it might be more appropriate for them to gather together. So everybody has their own different circumstances, and we're asking people to choose what's best for them under the circumstances in which they're living. So we can't have one set formula that will apply to everybody, but we do know that people want to do the right thing. I know that people want to get out and see more friends and family, but they're just not sure about how they should do it. And now with the social circles that where you don't have to maintain physical distancing, as well as the social gatherings where you do need to do so, it allows people to expand their group and to be able to see more people. We know that there have been many people who have been suffering from social isolation. We're seeing many more cases of mental health needs. The social circles should certainly help to alleviate that. It's not going to take all of those issues away, but it should help when people can reach out to the people that they're closest to and to see them on a regular basis without having to maintain that physical distance.
Next question.
Next question is from Christina Pinelia at CP24. Please go ahead.
Hi, Premier. Hi,
Christina.
Minister. Hi, Dr. Williams. Do you anticipate any enforcement of social circles?
Well, again, it'd be very hard to enforce with 14.5 million people. And that goes right back from day one, Christina. We rely on all the people in Ontario to follow the protocols, and they've done an incredible job. And we're asking them to do the same thing. So like the social circle police aren't going to be knocking on your door. We trust you're going to be doing the right thing and just follow the protocols. And it goes back to why we're at the numbers we're at, because everyone, the vast majority, have been following the protocols.
Follow up.
Okay, thank you. This question is for Dr. Williams, a bit of a follow-up to yesterday's announcement about long-term care homes and visitors. So as you, I'm sure, anticipated, many families are wondering about essential family care partners. As you know, there are people who act as their family's caregiver and every day visit their loved ones in these homes to care for their family member up until the pandemic. Why can you not allow essential family care partners into long-term care homes even once per week in the homes where there is no current outbreak?
So we have been following, and as the Premier noted, and the Minister, with our long-term care outbreaks, which has been one of our biggest struggles, and working through that issue. Our number of outbreaks are down to 65 at the moment. That still is a significant part. We still have some cases out there. Our cases and the residents and the staff are dropping. It's all going in a good direction. We understand, and we've been working for a long time, of how desperate family members are to reunite with their loved ones in those long-term care facilities. And as the first phase, this is the first phase, our committee, our IMS committee that's looking after the long-term care, and along with the Ministry of Long-Term Care, as Minister Fullerton spoke about, are opening up to have visitation at this level with proper precautions and safety, because we do not want to reintroduce it back into this vulnerable population. Let's see how this one goes, and in that aspect there. Still outbreak homes, we have to be very strict on that, not only for the safety of the residents, the staff in there, but also the visitors at the same time. So we want to use all those precautions. Again, this is a first step, and we have to keep monitoring, and we'll have to wait for more updates from the Ministry of Long-Term Care.
Next question.
Will be from Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. Question for you about the social circles, the start of phase 2 in some parts of the province, and also the changes to gathering rules. Is it inevitable that with all of these changes coming at once that we are going to see a spike in COVID cases over the next 2 weeks? And if that occurs, what is the province prepared to do?
Well, we hope not. We're going to be monitoring it over the next 2 weeks. And again, I'm a strong believer if they follow the protocols of what the Minister of Health and Dr. Williams have just mentioned, at least we can contain it. As I think it was Dr. Williams mentioned, God forbid, someone within your group of 10 catches it, you look at the 9 other people, so we can control the spread. And controlling the spread is absolutely critical. That's what drives the numbers up if we can't do the contact tracing properly and finding out who they've contacted to make sure that those folks get tested. So I think we have a good protocol in place. Let's give it a whirl. Everyone stick together like we have been from day one, and let's see what happens. If we come to that bridge, we'll cross it, but we'll see what happens over the next few weeks. I hope not. I hope we can continue on with the same trend.
Follow up.
And Premier, when it comes to outbreaks in workplaces, there's currently no provincial provision or requirement for public disclosure of where these outbreaks are taking place And I'm wondering if you think that the public across the province have the right to know if there is an outbreak at a business or a workplace in their community.
Well, I think what is a priority, the responsibility of the company to tell every single employee. They also have a responsibility to make sure they do deep cleaning and talk to the rest of the employees. And if they were in close contact with the person that does have COVID, they should get tested. And some companies, by the way, are being proactive. We have a whole list of companies that they're going to be tested, be it off the top of my head, Toyota. They have thousands of employees. They've asked the mobile units to come in there and test their employees, a voluntary test, obviously, but it really gives comfort, I believe, to if you're working on the production line at Toyota and you want to know that the person beside you has been tested, and that gives them a little more confidence, I believe. But they do have a responsibility to tell everyone within their company.
Last question.
Will be from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. I know you said the social circle police aren't going to come get you regarding the announcement today, but government officials today said that the public gatherings rule is still enforceable, that it's going to be a max of 10 and you have to physical distance. So if you're sitting in your backyard physical distancing with 11 people, or you have 12 people over for a barbecue who aren't part of your circle, are you going to be written a ticket worth hundreds of dollars? How much enforcing is still going to be happening, and what's your message to bylaw officers in terms of being reasonable now?
Yeah, we don't have enough bylaw officers or police to monitor people's barbecues and that. We have to go with faith and trust like we have from day one, Laura, and just hope people follow the guidelines that have been laid out. And so far they've been doing a great job. So let's just hope people follow it, and we'll see what happens over the next couple of weeks. So far, so good with the numbers, and let's see what happens after the stage 2 is opened up.
Follow up.
And just on another topic, regarding your phone call with Prime Minister Trudeau and the premiers last night, says you talked about the issue of racism and body cameras for police. I wanted to hear your reaction to the video of Chief Alan Adam being tackled and punched by the RCMP. What was your view when you saw that, and what are the leaders of this country going to do about it?
Well, I understand there should be, and if there isn't, there should be an investigation. I believe there's going to be an investigation, and they'll get down to the bottom of it. I have confidence in the RCMP that they will make sure they get a full investigation, and if someone needs to be held accountable, then they're going to be held accountable.
Thank you.
Thank you, everyone. Have a great weekend, safe weekend, and the folks that are opening up, support your local business.